Hi, my name is Dr. Tony Salome, and today we're going to be talking about a condition called fibromyalgia. Now, I'm sure many of you have heard what fibromyalgia or have heard of it, and basically what it is, it's a serious condition that actually affects many people, primarily females, and one of the major symptoms is pain, chronic pain in the muscles and in the tissues, and it leads to depression and chronic fatigue and so many other different elements that are associated with fibromyalgia. Many people who've been to fibromyalgia doctors have been to numerous doctors, and usually are diagnosed by a rheumatologist if they're diagnosed, because many of the doctors like to brush it off and not consider it as a real condition. But we understand that fibromyalgia is a real condition, and we understand the associations and the causations of fibromyalgia. Fibromyalgia is a problem in the neurological system of the body and in the metabolic system of the body. And what happens is when the nervous system does not operate properly, primarily right here in the brainstem, it affects our adrenaline, or the hormones that are our stress hormones that cause that sensitization and that cause those pain fibers to be always under heightened alert. So they're constantly sending feedback to the brain, and pain levels are constantly being perceived. And there are so many different factors and triggers behind this, and you can't just treat fibromyalgia by treating the label. We don't treat patients here in our office by their condition. We look at what their problem is, and we look at getting down to the root cause, because if you don't, it always comes back. And people saying that fibromyalgia is irreversible, and that's not necessarily the case. Fibromyalgia can be reversed, and especially if the proper treatment is being employed, meaning getting down to the root cause, looking at the primary triggers of inflammation, primary triggers that leading to gut function. All these things pertain and are related to causing fibromyalgia. So we look at you individually. We understand that you're a unique person, and you may be treated with fibromyalgia, and somebody else is treated with fibromyalgia, and we treat them totally differently because their problems are different. There's so many different types of methods to treat, and once we find out exactly what's causing the problem, then a proper treatment plan can be employed. So if you're interested in learning more about fibromyalgia, you can go to my website, www.thebaydoctor.com, and you can also call the office at 850-785-9372. Thank you very much for watching this video. I'm Dr. Salome, and have a great day.